అన్ఈక్వల్ బ్రెస్ట్ వల్ల చాలా మంది ఎంబారసింగ్ గా ఫీల్ అవుతారు. మన బాడీని 2 పార్ట్స్ లో డివైడ్ చేస్తే 10-20% asymmetrical గా ఉంటుంది. దాట్స్ వెరీ కామన్. కాకపోతే కొంతమందికి ఈ డిఫరెన్స్ చాలా ఎక్కువగా ఉంటుంది. ఇట్ ఈస్ వెరీ క్లియర్లీ విజిబుల్ అండ్ ఇది వాళ్ళ కాన్ఫిడెన్స్ ని చాలా లో చేస్తుంది. డ్రెస్ వేసుకునేటప్పుడు కూడా ఈ అన్ఈక్వల్ బ్రెస్ట్ చాలా క్లియర్లీ నోటిసబుల్ గా ఉంటుంది. అందుకే వాళ్ళు కంఫర్టబుల్ డ్రెస్ వేసుకోలేరు. సో మన దగ్గర కూడా ఈ పేషెంట్ అన్ఈక్వల్ బ్రెస్ట్ తో వచ్చారు. సో ఈ పేషెంట్ కి డెలివరీ తర్వాత వన్ సైడ్ బ్రెస్ట్ 70% బిగర్ అయిపోయింది యాజ్ కంపేర్డ్ టు ది అదర్ బ్రెస్ట్. బికాస్ ఆఫ్ దిస్ బేబీని ఫీడ్ చేసేటప్పుడు ఒక్క బ్రెస్ట్ లోనే ఫీడ్ చేసేవారు, సెకండ్ బ్రెస్ట్ తో చేయలేకపోయారు. సో మేము సర్జరీ చేసి రెండు బ్రెస్ట్ ని ఈక్వల్ సైజ్ గా చేసాం. సో ద పేషెంట్ వాజ్ వెరీ హ్యాపీ. సో ఆ పేషెంట్ స్టోరీని ఆవిడ దగ్గర నుంచి తెలుసుకుందాం.
So I recently underwent breast reduction surgery. The main reason for this is like from past 3 years I have a variation in both the breasts, like my left breast which was like 20% greater in volume than the right breast, and this was around 3 years back. Everything was perfect, like I had no issues. It was just the milk gland that was little grown up. So people just suggested me to just get out going with my pregnancy and all, and later how it can be done through surgical procedure. So last year I was pregnant. Initially I had no problems. It was just like as usual, like the 20-30% difference. So it wasn't much of a hectic for me. But once I delivered, the left one was started growing much bigger. It was like 70% bigger than the right one, and I couldn't feed my baby, which was like a biggest problem for me. And I did reach out to my gynecologist, and she suggested the same because the nipple was not outside, so it was very tough for my kid to even get hold of it to take the milk. So I had to sit for at least 2 to 3 hours every day with the milk exporter, and had to export the milk and feed her, which was like very problematic situation. So I was very low. I was like less confident because I had to wear 2 bras just to have both of them in sync, and I had to wear extra dupatta or shawl every time I had to go out or at least roam in the house. So I was very low confident. I had a lot of mood swings, and I wasn't able to take it because this was never a situation for me earlier. So it was a kind of a tough phase for me, because being a mother itself is a tough phase, and on top of it I had to undergo all of these for at least 5 to 6 months. So then I did discuss the situation with my husband. He's also a general physician, so he did ask me to reach out to a surgeon, take an advice if it can be done non-surgical or surgical procedure. So there were a couple of people that suggested Anjali ma'am's name. One of them is my husband. So initially when I came here, till the moment I reached Divyam, I wasn't confident enough because I didn't know like what would be the next step to go ahead to get rid of all this issue or the burden I was going through. So I did explain everything to the ma'am, and she was very confident that my old days could come back. So just looking at her face, I had this motivational spark. So I just said yes to the surgery. I got admitted just on a random day, took anesthesia, and within no time I didn't even realize that the surgery went. So I just got discharged within a day. It was very quick and without even knowing it. Even now when I look at the back days, like only pain I could see is the days that I had to hold these 2 things in place, not with the surgery. So now I'm perfectly fine. I'm able to hold my baby both sides. Earlier it was just the right side. Now I can hold her on the left side as well. Now you can see I'm without a scarf and a dupatta. So yeah, everything was very well done. She was very good at handling her patients. She was very friendly. She was such a sweetheart. So if you have any problems, anything, something similar to me, and if you have no person to reach out, you can come here, sit here, discuss your problems with her, and she'll take care of you.